The partnership with DispatchHealth has improved the care we provide through the Transitional Care Clinic at Valley Hospital. We have another avenue to treat patients. We can treat them not only now in our clinic, but also in their home. So it just gives us another avenue to give patients the quality care when they need it, where they need it.
It provides a lifeline to patients who maybe cannot go out of their home to the emergency room or the hospital or are unwilling. And it also provides the ability to do things like on-site lab testing, which I think is very, very helpful.
They're able to do any number of things for that patient, from drawing blood to a full assessment, to doing EKGs, to providing medications and treatments, from stitching to giving Lasix. And I really was very impressed with the range of services they can offer in the home.
I believe that what really helps our practitioners provide excellent care is an ongoing relationship between the providers at DispatchHealth and with the medical directors and the staff.
They are able to use what I know about the patient by calling me, so I can get them the expertise of what I know about the patient or their conditions. So at the bedside, they have me available to help with any information that I can give.
I review the charts, making sure that the education is there for all the nurse practitioners and physician assistants, trying to standardize care, coordinate care with the different professionals that we work with.
At Valley Hospital, I take care of patients who have chronic congestive heart failure. And despite our best efforts trying to see them in our clinic frequently, sometimes they're just not feeling well enough to come to visit us, or they don't have a ride.
DispatchHealth has become the eyes and ears to see what's going on with this patient, and they've helped us keep people in their homes who otherwise would keep coming to the emergency room for potentially very simple things. And it's a way of keeping someone who's elderly or infirm or has difficulty understanding the world around them in their home, where they're much more comfortable and much more able to retain their mental abilities.
My father-in-law had dementia and was constantly shipped back and forth to hospitals where he was in hallways for hours on end. It's documented that that type of thing will set back somebody with dementia for 4 to 5 days after that visit. We'll actually see these patients in their home, not changing anything about the environment that could startle them or confuse them, and do all the blood work, the EKGs, the physical exam, prescribe medications, arrange x-rays, without having to move those people out to an environment that is just devastating for them.
My experience with DispatchHealth has been overwhelmingly positive. I have one patient in particular. The patient is someone with chronic lung disease, and she's on home oxygen. She called the office stating that her oxygen levels were dangerously low.
The patient had been in and out of the hospital multiple times in the past several months. We sent our team over, even though it's way out of where we normally would go, and we're able to actually find out that the patient's oxygen tubing, which was 15 years old, was actually kinked and corroded, so the oxygen wasn't getting through. So we were able to adjust medications from what she had changed in the hospital and also change the oxygen tubing, being able to save this lady from going back to the hospital, which was something she refused to do.
One of my patients had difficulty coming to the office. It's been 4 years since we've seen them. It's been 4 years since they were able to come to the hospital and really get any kind of care. DispatchHealth came and immediately made a personal bond with this patient. And then they came back a couple days later and were able to work with this rapport, work with this bond that they had formed, and said, you know, you really are sick, and you're going to feel so much better when you come out to the hospital, and we're going to help you get this treatment. We can see that you're getting very much worse. This person came out to the hospital, got admitted, stayed, got much better, is now home, able to walk about, able to get around, able to feel much, much better.
DispatchHealth helps us keep our readmission rate at Valley Hospital low by allowing us to identify symptoms early and treat them appropriately so they don't escalate to the point where patients need a hospitalization.
The DispatchHealth nurse practitioner will contact the physician several times and contact the patient several times as well to make sure that things are resolved.
A lot of what we're doing is just making sure everything is in place, that their patient's doing okay in that situation, checking equipment, checking their medications, checking the prescriptions to make sure everything is where it should be.
This really helps the Valley Hospital reduce the number of people that might get admitted. It certainly helps them project, I think, a very positive image in the community about its ability to care for people in their homes. And I think it really makes the people in the community feel like they're part of the hospital. The hospital's part of their home environment because now the hospital's in the home. It's able to bring that kind of expertise right there to help you out and keep you healthy.
There are so many issues that can be dealt with in the comfort of a home that don't require the patient to leave whether to an urgent care or a hospital setting.
I think that it's probably going to be a big threat to urgent cares because they require you to actually get out of your house and take your pajamas off, and we don't.
It's a wonderful service that brings you care when you need it, with a great deal of expertise and ability to stay in touch with your doctor.
Based on our capabilities of what we're able to provide the patient in a mobile setting, I would definitely feel comfortable with patients and loved ones being cared for by the dispatch team.
We're very proud and happy to be partnering with this excellent group of practitioners, and we plan on using them in the future to help keep our patients healthy.